Hi, today is Thursday, October 13th, 2011. Um, I had upper and lower jaw surgery last Tuesday, so it's been 9 days since the surgery itself. I decided to wait this long just because I couldn't really talk that much. I couldn't really be understood before, and I kind of just forgot to make videos. So this is my second video since the first one I made was the night before surgery. Um, I want to talk about a few things that I haven't seen other people talk about because I watched a lot of videos before I got my surgery and I didn't hear a lot of people talk about these things. So, um, first off, I did get both upper and lower. Um, I don't know if, the first thing I want to say is I think it's different for everybody in terms of like recovery, healing, what you're going to look like, swelling, things like that. I had my wisdom teeth taken out a few years ago, and I was pretty swollen when that happened, so I knew I was going to be pretty swollen after this one also. Some of the people I've seen after like 4 or 5 days aren't really that swollen, but I'm still pretty swollen on this side, especially. This side is not too bad anymore. Um, and then also for me with my upper jaw, when they moved it forward, my nose kind of tipped up a little bit, which is good. I think I'm happy with the results so far. It's kind of hard to see because of swelling in here still, but from what I can tell, I like what I'm seeing in there. um, Let me just talk about a little bit the first couple of days after the surgery. Um, right after surgery, you're pretty much out of it. You're just in the hospital. I stayed for one night, um, just on medications and stuff. So I was feeling okay, just pretty much out of it at that point. Um, Day like 1, 2, 3, and 4 are pretty hard. My whole body kind of felt sick, and my face just felt like it was huge. Um, my nose is really stuffy all the time, which is really annoying. Um, Really not that much pain, just because you have a lot of medicine that you're on, but a lot of discomfort and just you're just not comfortable at all. Um, Sleeping is a huge pain. I woke up like every hour, every 2 hours. I just turn the TV on, watch TV for a little bit, take a little bit more medicine when I was allowed to, and then try and go back to sleep. You're also supposed to sleep sitting up to help the swelling go down, so that's a little different than normal, so it's kind of hard to get used to also. Um, One thing I would recommend though is to find like a good TV show or series that you like that you haven't seen or something and watch it because you don't want to be thinking about it. You can't change what's happened, so you just want to take your mind off of it and do something else. I've been watching Dexter a lot. There's 6 seasons, 12 episodes a season, and each show is an hour long, so I just keep watching those over and over again. Uh, in sequential order, so it's been taking up a lot of time. Takes your mind off of it. Just kind of the days go by quicker, or like movies or something like that, so you're not uh, just thinking about it. Um, what else? Um, the first 4 or 5 days are pretty bad, to be honest. Um, but you'll get through it. It's just something just to know what to expect. After the first 4 or 5 days, the pain the whole time is not really that bad at all. It's just kind of sore up in here, just kind of almost like, uh, I guess sore is the best way to describe it. It's not painful, it's just really sore, and in here, um, it's so that's that, but, um, after like day 5, it gets so much better. You just feel better. Your whole body feels better. Um, you don't have, swelling goes down a little. My nose hasn't been as stuffy, which has been great. Um, what else? Um, I can give you a close up on my teeth. I have rubber bands holding me down to keep my bite in place. I also have a plastic splint in here. So it's like a molding. So they like mold your top and bottom teeth like a plastic uh, mouthpiece almost looking thing. And that kind of keeps your teeth clamped down so you have the rubber bands. So that's a close up on my teeth. You see the rubber bands. You can still open your mouth a little bit, so that keeps you, from going insane. It's annoying to have your mouth closed all the time. Um, Another thing I noticed was sometimes it feels like my mouth is like really clamped down really, really hard. And I asked the doctor about that, and he says that's perfectly normal. That it's because of spasms in your jaw. Like your muscles will spasm and they'll like clamp down uncontrollably, really, really hard. I've noticed that for like the past 4 or 5 days, uh, which is again annoying. But what else can I say? It's definitely getting better. Every couple of days, I can notice it's getting a lot better. I can, physically you can move around. You can move around just fine. And from the neck down, I feel 100% right now. It's just kind of really, it's just disconvenient and uncomfortable. Um, I'm starting to get a little tender underneath here. Just the touch kind of hurts a little if I put some pressure on it. I'm not really sure why this right side is a little more swollen. The doctor just said that's the way it goes. That's the way it went with me. But things are going good. And if you have any questions, I did this whole thing myself. Obviously, I'm 26, so from the start to finish, from the doctor, the oral surgeon, the orthodontist, did all the insurance and all that kind of stuff myself. So if anyone has any questions, I live in Chicago, so I have an unbelievable surgeon and orthodontist I could recommend to anyone that is interested. I could not be more happy with either of them. They're unbelievable, very nice, so accommodating in every way. So if you have any questions at all, I mean, I'm doing this to kind of track myself, but also to see, try and help anyone else out there. So, I don't know how many people are going to be watching this, but even if I help one person, it'll be worth it just to give someone some information about it. If you're scared or just don't really know what to expect, I've tried to talk about some things I haven't heard other people talk about, just to give you, more information of the real life about it. Um, Obviously, I'm still on a liquid diet. That's going to be for like another 5 weeks, which I'm trying not to think about too much because that's going to be pretty brutal. Uh, and obviously, I'm going to lose some weight, but that's the way it is. I'll be alright. I've just been drinking Gatorade, water, Ensure protein shakes, milkshakes. I've eaten like ground up macaroni and cheese, which is, a different flavor, a little bit of thickness there. Um, that's really about it. That's all I can think of to say at this time. But I'll make another video in a few days. I mean, at this point, day to day, it's really not that bad anymore at all. It's just uncomfortable having. I mean, your teeth are just touching at all times. You can't like stretch out, which is it's just uncomfortable. It's not, it's not painful. It's just very uncomfortable. But if you have any questions, please don't hesitate to ask. I'd like to help anyone that wants help or any questions that you have. Um, and then, things aren't really changing that much at this point. I'm just waiting for the swelling to go down, especially on this side. My lips are numb. That's you would expect if you've been watching anyone else's videos. It's the same for everybody. But yeah, that's about it. I'll make another video in a few days when I see some improvement. But pretty much right now I'm laying around watching TV shows and movies and things like that. So any questions, feel free to ask, and I will make another video in a few days. Thanks.